hormone and hormone antagonist. In this unit, we discuss about firstly insulin hormone. After that, it is secreted into the beta cells of islets of Langerhans of the pancreas. After that, we discuss about thyroid gland. Their secretion is thyroid hormone, in which T3 and T4 hormone, where T3 triiodothyroxine, thyroxine, and also calcitonin. It is secreted by the thyroid gland to regulate the balance or to maintain the balance of calcium ion in the body. The next point we discuss in this chapter is sex hormones, in which female sex hormones. Up to this, we discuss in our last lecture. So in which different types of the hormone present in our body, and they perform vital role for the maintenance and growth or development of the different body functions. Adrenal gland secrete adrenaline, pancreas secrete insulin, thyroid gland secrete thyroxine T3 and T4 as well as calcitonin. Then growth hormone GH, it is secreted by the pituitary gland. Also FSH, LH, follicle stimulating hormone as well as luteinizing hormone. So in which these are the different hormones, in which sex hormones we discuss here. Female sex hormones, progesterone and estrogen. These hormones are responsible for controlling puberty, reproduction, birth and lactation, and these hormones refer to the secretions of the reproductive hormone disorder. If there is overproduction of this hormone or underproduction, means there is excessive production of this hormone or less production of the hormone, it effect on the sexual characteristic or their development. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
Discuss about firstly estrogen. Estrogen, in which natural estrogen, the major estrogen, it is produced estrogen, it is estrogen and progesterone. These are the both the secretions of the reproductive system or the hormone secreted into the female reproductive system. As you all know, different parts of the female reproductive system such as cervix, vagina, uterus, placenta, ovaries, fallopian tube. So where this secretion is to be occur. Then after that, we discuss about properties or pharmacological action of this estrogen, in which this hormone is essential for the secondary sexual characters in the females such as puberty, growth, lactation, menstrual cycles. So all these necessary secretion of this hormone. Also, it is responsible for the growth and activity of the mammary gland and endometrium. So in which endometrium, it is a mucous membrane lining of the uterus. And next pharmacological action or property of this estrogen is it is used to prepare the uterus for the spermatozoa transport. So as you know, spermatozoa transport, it is transfer of the sperm towards the ovulated eggs. So for this action or this property is performed by the natural estrogen. The next point, synthetic estrogen. So this natural estrogen, sometimes they are not effective or they do not possible to given by orally. So that's why some synthetic preparation, their pills are formed synthetically, and the synthetic estrogen is to be used for to maintain this maintain this all this property by administration of this synthetic estrogen. So after that, we discuss therapeutic application of this estrogen, in which it is used into the menopausal syndrome, ovarian dysgenesis, where menopausal syndrome means stoppage of the menstrual cycle, that is seizures of the menstrual cycle. You already studied this part in 12th as well as in anatomy. Different stages of the menstrual cycle, in which seizures of the menstrual cycle, it is a menopausal syndrome. The next point is ovarian dysgenesis. Ovarian dysgenesis means there is an abnormal development of ovaries. Then primary amenorrhea. Amenorrhea, that there is absence of menstrual cycle or menstruation. Then carcinomas of prostate in the male. So it is one of the type of the cancer which is occur into the prostate in the male. Then this to treat the breast cancer to the postmenopausal women. Postmenopausal means they undergone to the menopause, that is stop of the menstrual cycle. Then to treat the uterine bleeding and endometriosis. Here one more advantage or application of the synthetic estrogen is to treat the uterine bleeding and endometriosis. Endometriosis means there is inflammation to endometrium, and uterine bleeding, as you all know, there is bleeding from the uterine or vagina. Then to treat the dysmenorrhea. Dysmenorrhea, it is painful menstruation. Then next point, it is used as a contraceptive, oral contraceptive with the progesterone. So there are different types of the oral contraceptive. They are help to prevent the conception. So for such type of the preparation, this estrogen is to be added with the progesterone, and their combined pills are made to avoid or to prevent the conception. Then next point we discuss in this chapter is contraindication of this estrogen. So it is contraindicated into the following conditions such as hepatic as well as renal diseases, in liver and kidney diseases. Also in undiagnosed genital bleeding. If there is undiagnosed, there is no diagnosis of this vaginal bleeding, why it is occur or how it is occur, then such type of the undiagnosed genital bleeding, this estrogen is contraindicated. Also it is contraindicated in premenopausal carcinomas of the breast and the uterus. Carcinoma, it is type of the cancer which is occur to the breast or the uterus. So it is occur when premenopause. So such type of the condition, this estrogen is to be contraindicated. The next point, side effect, nausea, vomiting, breast tenderness. The next point, salt and water retention. There is mineral retention and it causes weight gain, edema. Edema, as you all know, there is deposition of the fluid, and cardiac failure, there is CVS failure. So these are the side effects. The next point is preparation, in which naturally occurring estrogen, their preparation estradiol and semi-synthetic steroidal estrogen. Their preparations are quinistrol, mistranol, ethyl estradiol, and their dose is to be given. The next point, semi-synthetic steroidal estrogen, benzoestrol and ixoestrol with their dose, and they are taken by oral route. The next female sex hormone is to be progesterone. Same point we discuss about this, in which first see their properties or how it is synthesized. So progesterone, it is an steroid derivative. It is under the steroidal category. Pregnant, it is a natural progesterone. Progesterone, in which the natural progesterone, it is termed as pregnant, and it is synthesized into the ovary, testes, placenta, and adrenal. It is progesterone, it is synthesized in slight amount into the testes. We all discuss it is a female sex hormone, but in the slight amount, in the small amount, it is secreted into the testes. Also, it is major female sex hormone. That's why it is synthesized into the ovary and the placenta as well as adrenals. That is into the adrenal cortex of the adrenal gland. Then the progesterone synthesis mainly occur into the corpus luteum, and it having the very short plasma half-life is 5 minutes. Then about their pharmacokinetic, their metabolism and the excretion. So it is metabolized by the liver and excreted through the urine as a sulfate and glucuronide conjugation reaction. The metabolism is occurred through the different types of the phases, as we discussed in the first unit. There are different phases of the metabolism. What is meant by metabolism? So this metabolism of this progesterone is occurred by the glucuronide conjugation reaction. Then progesterone synthesis mainly occur in corpus luteum. So corpus luteum, it is a mass of cell, and that forms towards the ovary. And ovary, it is a major organ of the female reproductive system. So here this progesterone hormone is to be synthesized. The next point, pharmacological actions. In pharmacological action, it induces secretory phase in endometrium. In endometrium, at the mucosal lining of the uterus, where it acts as a or produces secretory phase. This progesterone hormone acts as a secretory phase. Mainly, the need of this progesterone hormone or their secretion is to be increases into the female during the pregnancy. So, am I audible to all?
Yes, ma'am.
Yes, ma'am.
Okay, so progesterone, it is a female sex hormone and it is secreted mainly at the stage of pregnancy in the female. That's why this hormone is known as pregnancy favoring hormone. This one asked for MCQ. Which hormone is known as pregnancy favoring hormone? So it is a substance, it converts the estrogen of proliferative endometrium to the secretory maintenance of the pregnancy. So that's why this hormone is known as pregnancy favoring hormone. Generally, it is synthesized into the reproductive system or in the ovary at the time of pregnancy. Either it is in the first trimester, second trimester. Then if ovum is not fertilized, the secretion of progesterone is inhibited. If there is ovum is not fertilized at that time, secretion of this progesterone is inhibited or stopped. So OHM, Plura, OHA, these are the single release forms of the female reproductive system. Then it is also responsible for onset of the menstruation. For onset or starting of the menstrual cycle, this hormone is responsible. If ovum is fertilized, then progesterone prepare endometrium for implantation. If ovum is not fertilized, then it does not prepare endometrium for implantation. If there is ovum is fertilized, then progesterone hormone helps to the endometrium prepare for the implantation process, that is for the development of embryo and remaining process. Then progesterone develops the breast cancer for the lactation. If there is excessive secretion, then it develops the cancer. Then it develops this for the lactation. Then it makes uterus less sensitive to oxytocin. Oxytocin, it is a hormone. For this hormone, progesterone shows their pharmacological action rather than this and makes the uterus less sensitive. Then synthetic progesterone, their preparations or the derivatives are classified into the three categories: testosterone derivative, progesterone derivatives, 19 non-testosterone derivative. Therapeutic uses in which diagnostic to test the estrogen secretion and as a oral contraceptive. Contraindication, it is mainly contraindicated into the following conditions, such as it may increases the blood pressure in female receiving the progestin. Increase in BP means
Hypertension.
Hypertension.
so in the hypertension condition, it is contraindicated. And next one, it may causes atherosclerosis. So atherosclerosis means there is cholesterol or fat level, it is get increased and narrowing of the blood vessel is to be occur. So in both the disorder, this progesterone is to be contraindicated. The next point, their preparations. Up to this, we cover into the previous lecture, right?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay, this point, last point, it make uterus less sensitive to oxytocin. So oxytocins are such type of the agent. They act on the uterus. So at the time of it makes means progesterone makes uterus less sensitive. If uterus is more sensitive to oxytocin, then it is difficult to carry out the conditions like development of embryo, that is pregnancy. So that's why to lower the action of this oxytocin on the uterus, this progesterone is act as a less sensitivity, to reduce the sensitivity of oxytocin. And if there is less sensitivity of oxytocin, then it will be helpful to, there is continuous or normally development of the embryo. If there is excessive action of this oxytocin, then it is not helpful for growth of embryo. Then next point, we discuss male sex hormones. Screen is visible to all.
Yes, ma'am. Yes, ma'am.
Okay, so in male sex hormone, the male reproductive system having the secretion testosterone. So this is male sex hormone, in which we have to discuss about their pharmacological action, that is properties, about their synthesis and their pharmacological actions, pharmacokinetic contraindications, uses. In which first one, the male gonads are the testes. Testes have the double function to produce and secrete the male hormone testosterone and to produce the spermatozoa. So spermatogenesis, for the process of spermatogenesis, this hormone is responsible. So spermatogenesis, it is a process in which there is production of the sperm from the immature male germ cells. For this process, this hormone is responsible, and the pituitary gonadotropin, LH, stimulating intestinal cells in the testes to produce the testosterone, and FSH promote the spermatogenesis by germinal cells. What is meant by LH and FSH? Not able to all.
Luteinizing hormone and FSH follicle stimulating hormone.
Okay, so male sex hormone, we can say either it is testosterone or the androgen. So this hormone having the double function to produce and secrete the male hormone as well, male hormone testosterone, and to produce the spermatozoa. So spermatozoa, it is related to spermatogenesis process. So spermatogenesis process. Spermatozoa, it is a process in which the male sex cells carry the genetic material, that is sperm. So for this process, this hormone is responsible. And next point is the pituitary gonadotropin, LH, that is luteinizing hormone. It stimulates intestinal cells in the testes and to produce the testosterone, while FSH, that is follicle stimulating hormone, they promote for the spermatogenesis process by the germinal cells. So there are different cells discussed here, and that also different hormones discussed here, both having the action on the reproductive system of the male. So this FSH promote the spermatogenesis process. So spermatogenesis process, it is a process in which production of the sperm from immature male germ cells, and LH, it is helpful to stimulate the secretion of testosterone from the intestinal cell. The next point is plasma testosterone level is to be normal adult male range from the 350 to 1200 ng per dl. Ng per dl. What is full form of this? Ng per dl means any idea? Am I audible to all?
Yes, ma'am.
Yes, ma'am.
Okay, so plasma testosterone level in the normal adult male ranges from the 350 to 1200 nanogram per dl, where nanogram per dl, Ng per dl means nanogram per deciliter. So testis produces 5 to 12 mg testosterone daily. There is conversion into the mg, and here it is given into the another unit, that is nanogram per deciliter. So in mg, testis produces 5 to 12 mg testosterone daily. Then next point, this testosterone, it is an androgen or testosterone. It is a male sex hormone and which responsible of normal development at the puberty and to maintain the fertility and libido. It produces testes, adrenal gland, and the ovary. So it is synthesized into testes, adrenal gland, and ovary. So this is a male sex hormone, but it is in the slight amount present into the ovary. So sometimes there is increased secretion of testosterone in the ovary or into the adrenal cortex in the female. If this secretion is increases, it is present in the slight amount, small amount. If there is secretion is to be increases, then female shows some male-like symptoms. Then next point, libido means opposite attraction of the sex. Then fertility, as you all know. Fertility, it is quality being to be fertile or productiveness. So for this processes, this hormone is responsible. The next point is to be pharmacological action, in which it is responsible for development of the secondary sex character which occur at the time of puberty in the male. So at the time of puberty, this hormone is to be essential and it produces their particular characteristic. It shows their particular characteristic or their effect at the time of puberty in the male, and it is responsible for puberty into the male. Then it is responsible for the growth of reproductive system. For the growth of male reproductive system, it is important hormone, and their it is the growth is depend on their secretion. Then next point, it is responsible for the growth of hairs at the pubic hairs, beard, body hairs, or auxiliary hairs. Then it increases the secretion of sebaceous gland. Sebaceous gland, it is related to what do you know about sebaceous gland? What is the role of sebaceous gland? All are present?
Yes, ma'am.
Yes, ma'am.
Sebaceous gland, what is mean by where the location or what it perform the roles? Sebum, sebaceous gland. Repeat again.
स्किनच्या लेयर्स मध्ये.
Okay, so sebaceous gland, a microscopic exocrine gland into the skin, and that open the hair follicle and to secrete the oily as well as waxy matter, that is sebum. So for this sebaceous gland, increase the secretion of sebaceous gland means increases the secretion of waxy matter or oily secretions is to be increases by the sebaceous gland. They secreted this secretion, and this secretion is increased by this hormone. Then next point, behavioral effect observed such as aggressiveness, then increase in physical activity. These behavioral effects are observed. Aggressiveness means excitement. Then next one is it is responsible for maturation of the sperm. So this hormone is responsible for the maturation of the sperm, and after that the spermatogenesis process is to be occur. The next point, it also important for intrauterine development into the male phenotype. This means also action of this testosterone hormone. It is important in intrauterine development into the male phenotype. Then their action on the skeletal muscle. Androgen or this testosterone, it is responsible for the rapid growth muscle and the building of bone mass and increases the body weight as well as increases the appetite. So mainly they perform role or function. Their function is on the skeletal muscle is that they produces rapid growth of the muscle and building the bone mass or increases the body weight. Then last one is action on the erythropoiesis. Erythropoiesis means erythropoiesis.
Synthesis of
Formation of blood cells, RBCs. So for this process, they helpful, they increases androgen or testosterone hormone, they increases the erythropoiesis by erythropoietin. Secretion increase and also increases the HB level. Then also there is this hormone. If there is secretion is to be increases, then it produces libido. Libido means there is attraction towards the opposite sex. So these are the pharmacological actions or the properties of the testosterone or androgen. The next point is synthetic testosterone. So their applications are given. Before that, after the pharmacokinetic, we discuss about pharmacological action. We discuss about pharmacokinetics. So in which first one, naturally androgen or the testosterone is to be inactive orally. So that's why it is rapidly degraded into the liver. So it is given by parental route and they are synthetically formed. So naturally the androgen, testosterone आहेत, they are inactive orally. They do not show any effect or any action. They just degraded into the liver. That's why natural androgens or testosterone are not given. They are given after the preparation of their synthetic form. So त्याचे synthetic form केले जातात and after that they given to individual or the patient. So there are different synthetic androgens are formed. Their example are methyl testosterone, flumexotestosterone. So they are effective orally. जे synthetic आहेत ते orally effective आहेत. जे natural आहे ते orally effective नाही. So they are excreted through the urine and T half life. किती आहे T half life?
10 to 20 minutes.
20 minutes.
10 to 20 minutes. So the synthetically formed androgen or the testosterone, they having some advantageous applications, and that's why it is synthetically prepared and used. So in which we discuss about synthetic testosterone, their therapeutic applications. Roll number 19. Are you present? Jadhav Divya.
Yes, ma'am.
What is the therapeutic applications?
Yes, ma'am.
Read the therapeutic applications of synthetic testosterone.
To treat carpos, ma'am.
Cryptochildism. Next.
As replacement to therapeutic in hypogemnodism to treat an
Ready. Continue. 9.
to treat used to treat breast cares. It used to is used in application anemia or leukemia.
Okay, so this natural androgen or the testosterone, they are ineffective orally. That's why some preparations are made from this synthetically, and they're having the different applications. It is therapeutically applicable for the certain conditions. To manage or to treat the following condition, they are applicable, such as first one, to treat the cryptochildism. Cryptochildism means, any idea about this? Yes or no?
No, ma'am.
To treat the cryptochildism means a condition which is one or both testes fails to descend from the abdomen into the scrotum. There is failure of the testes. That's why it is termed as the cryptochildism. Generally, it occurs at the birth, so that's why there is childism is termed for this disorder. So to treat such type of the disorder, this synthetically prepared testosterone are used. Then next point, as a replacement therapy in hypogonadism. So hypogonadism, it is a disorder where there is a failure of the gonads or the testes or the ovaries. So in such a condition, these synthetic testosterone are useful as a replacement therapy. Then next point, it is used to treat the breast cancer. Then next point, it is used in the aplastic anemia or the leukemia. What is meant by leukemia? What is mean by aplastic anemia? Leukemia, we were discussed in the drugs acting on CVS, anemia, leukemia. Different types of anemia. What is mean by
Anemia means
leukemia?
blood loss.
Blood.
Blood?
Decrease in
Cancer.
blood.
Leukemia, it is blood cancer. So to treat the aplastic anemia and as well as leukemia, it is a blood cancer. And aplastic anemia, it is one of the type of anemia where it is a rare condition. In this condition, there is body stop or prevent to produce enough amount of new blood cells. So that is aplastic anemia. In such a condition, the synthetically prepared testosterones are used. The next point, pharmacokinetic, as we discussed, metabolized in liver, inactive orally. Synthetically आहेत ते metabolize होतात liver मध्ये, but natural they are not active and also they are not metabolized. That's why they are synthetically formed. The next point is adverse effect. Screen is visible to all.
Yes, ma'am.
Yes, ma'am. Ma'am.
Roll number 45. Are you present?
Yes, ma'am.
Read the adverse effect.
Yes, ma'am. Adverse effect. First, acne in male and female. Second, mucilization. Third, odema. 4, weight gain. 5, hypotension. And 6, oligospermia.
Was the adverse effect of synthetically or natural androgen or the testosterone are given as follows. In which first one, acne in male and female. Do you know about acne disorder? Acne, it is disorder of seriously, you have no idea about acne second year. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
So we
Yes,
discuss about
ma'am.
adverse effect, in which first adverse effect is
Acne in male and female.
Acne in male and female.
What is mean by acne?
And the skin disease आहे.
Skin related.
Red pimples
Half
on
knowledge,
the
only
skin.
skin related. Skin related?
Red pimples on the skin.
Okay, so it is a skin condition that occurs when hair follicles plugs with the oil and dead skin and the cells. That is pimples. So this condition, acne condition, is occur because of there is hair follicles comes in contact with the oils. Oils, it is secreted by sebum gland. So this secretion and this hair follicles and dead skin cells, when they comes together, then they form this acne disorder. So this acne in the male and female, these are the adverse. It is an adverse effect of the synthetic testosterone. The next one is musculization. Musculization means, as we discussed in the pharmacological action, if the androgen is present in the female, it increases the testosterone हे mainly secretion male reproductive system चा आहे, right? So if there is a slight amount of secretion, it's secreted into the adrenal cortex of the female. Slight amount मध्ये androgen हे female मध्ये secrete केलं जातं adrenal cortex मध्ये. जर ते secretion increase झालं, if there is increase in the secretion into the female, at that time they show male like characters. So that is change in the voice, excessive body hairs. So this occurs and this change is known as musculization. So this is adverse effect of this testosterone. The next point, edema. What is mean by edema? Accumulation of fluid, right?
Yes, ma'am.
Yes, ma'am.
The next point, weight gain. Weight gain means increase or decrease in weight, body weight.
Increase in body.
Point, as you know, decrease in BP, that is hypotension. And last one is oligospermia. Oligospermia means there is decrease or low sperm count into the semen. So this is low sperm count is known as oligospermia. So these are the adverse effect of the synthetic testosterone or the androgen. And also there is this one also important one point asked for MCQ. In female androgen, they secrete slight amount of in female adrenal cortex, they secrete slight amount of androgen, and if there is increase in the secretion, then what happens? Or the process is known as, so this process is known as musculization. And in musculization, in the female there is increase the secretion of androgen into the adrenal cortex, and they shows male-like characters. This termed as musculization. Do you understand adverse effect? Adverse effects समजलेत
Yes,
का?
ma'am.
Yes, ma'am.
Yes, ma'am.
The next point, contraindication. So the synthetically prepared testosterone or androgen contraindicated into the following condition. In which condition? First one, hepatic
Liver
disease. That is,
Liver disease.
Liver disease.
then second one,
Carcinoma of prostate.
Carcinoma of the prostate.
then last,
Hypertension.
Hypertension.
okay, so these synthetically prepared preparations are contraindicated in the following conditions such as liver diseases, hypertension. This both you know. What is meant by carcinoma of prostate? Carcinoma means
Cancer of prostate gland.
okay, so carcinoma of prostate means there is prostate cancer and it occurs at the prostate gland and they are just located below the bladder in the male. Then next point, preparations. synthetically prepared testosterone preparation given as follows, in which first one is testosterone injections, 50 mg by IV route 3 times weekly. Then next, testosterone propionate, 5 to 25 mg IM intramuscular route 4 times weekly. Then methyl testosterone, 25 mg to 50 mg sublingually or by orally. So these are the preparations of the testosterone. Roll number 63, are you present?
Yes, ma'am.
Read the preparations. Screen is visible to all.
Yes, ma'am. Yes, ma'am.
63. $64. Am I audible to all?
Yes, ma'am.
Yes, ma'am. Yes,
Yes,
ma'am.
ma'am.
63 and 64. Are you present? You both, you can remove left from the class.
Yes, ma'am. 63, ma'am.
जर लक्षात नसेल तर लेफ्ट होऊ शकता. नेक्स्ट लेक्चर जॉईन करा.
त्याला घरी गेलता ते डबा आणायला, त्याच्यामुळे
63 प्रिपरेशन्स रीड करा. $64, $65.
Yes, ma'am.
Read the preparations.
Testosterone injection 50 mg IV 3 times weekly. Testosterone propionate 5 to 25 mg oil IM 4 times weekly. Methylsterone 25 mg to 50 mg sublingually over a day.
Can anyone read properly this preparation? Ha, 49. Are you present?
Yes,
49.
yes, ma'am.
Read the preparations.
Testosterone injection 50 mg intravenously 3 times weekly. Testosterone propionate 5 to 25 mg oil intramuscular 4 times weekly. Methylsterone 25 mg to 50 mg sublingually or orally.
Sublingually or orally. So these are the preparations and their dose are important, which is asked for MCQ. That's why I told you read it. The next point is oral contraceptive. Here we complete about hormone. The next point is hormone antagonist. As we seen in the previous lectures or in this unit, firstly we discuss about hormone and after that we discuss about their oral contraceptive like insulin. Then their oral hypoglycemic agent, anti-diabetic agent. After that we discuss thyroid hormone and then after that we study about antithyroid agent. Similar for this, firstly male and female sex hormone and after that oral contraceptives. So let's start the next point, oral contraceptives. Screen is visible to all.
Yes, ma'am.
You all have idea about this contraceptive because this part is covered in health education. in first year. So let's discuss about it in short. Firstly, in this chapter, we have to discuss what is contraceptive, what is meant by oral contraceptive, then what is mode of action, that is mechanism of action of this oral contraceptive, how they act when they taken these combination pills or their preparation when they taken orally, then they how act to prevent the conception. The next point is therapeutic applications, their side effect, contraindications, some drug interactions and precautions. So let's start from the definition of the oral contraceptive. As per their name, oral means they are taken by which route?
Orally.
Oral.
Of course, orally. So oral contraceptive, these are the medicines, they are taken by the oral route, or these are the hormonal preparations. Generally, they are hormonal preparations. They are prepared by the synthetically, and they are used for the reversible suppression of the fertility. Or oral contraceptive are the medicines. They are taken by the mouth, and they help to prevent the conception or the pregnancy. So such type of the medicine is known as oral contraceptive. They are also known as birth control pills. There are different types of the oral contraceptives in which combined pills, sequential pills, in which male contraceptives and the female contraceptive, they are differ and they both having the differ functions. Firstly, all of you get the definition of oral contraceptive. What is mean by oral contraceptive? What is
Medicines which are taken by mouth to help prevent pregnancy.
Prevent pregnancy.
okay? So these are the medicines. They are taken by the mouth, that is by oral route, to prevent the conception. Is known as contraceptive. Then these are the also we can say these are the hormonal preparations. Means sometimes they may be formed by given some synthetic preparations or the natural androgen, testosterone, progesterone, anything from it, as we discussed in the hormones, and then they get combined together and synthetically prepared. So there are different two types mainly of these contraceptives, such as male contraceptive and female contraceptive, in which there are different types of the pills, combination pills, mini pills, emergency pills, phasic pills, and they are given at a particular time, and at that time they shows their effect to prevent the conception. They are also termed as a birth control pills, in which birth control pills, that is oral contraceptive, are the preparation medication. They prevent the pregnancy. Then birth control, that is contraceptive medication, contain hormones. As we say, these are the hormonal preparations, and after that they are synthetically prepared. So these are the these are the medicaments. They contain hormones such as either estrogen, progesterone, or progesterone alone. Then birth control pills may be prescribed to reduce the menstrual cramps or to prevent the anemia. So these pills, they are prescribed by the physician to reduce the menstrual cramps and to prevent the anemia. So menstrual cramp, it means it is caused menstrual cramp means there is contraction to the uterus. So this birth control pills, they prescribe to reduce the contraction of uterus. Then next point, some women experience various level of side effect of the birth control pills. So these birth control pills, they are used as a oral contraceptive. They are used to prevent the conception, but they having the some major side effects. The next point, classification. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, so in their classification, here discuss about combination pills, sequential pills, mini pills. There are many formulation of oral contraceptive, but in your syllabus, These 3 pills are given, and also there is modification and newer formulations are available for the oral contraceptive. In your syllabus, these 3 are given. So male contraceptive, they inhibit the spermatogenesis process, that is formation of the sperm is inhibited by the male contraceptive, and that's there is complete suppression of spermatogenesis process is occurred due to the male contraceptive, and the drug which suppresses the spermatogenesis process are progesterone therapy, cytotoxic drugs such as nitrofuran, then codenium, and anti-androgen agents. They reduces the motility of the sperm and act as a contraceptive. Then next is female contraceptive. In which female contraceptive, these are the drugs or the medicines, they suppress the fertility with the 100% assurance and complete the return of the fertility is possible. Means they completely help to pause or to stop the conception process, and there is 100% assurance of this conception, prevention of the conception and return of the fertility. Sometime in some females it may be occur, or there may be because of their side effect there is no chances of fertility because of administration of this oral contraceptive or contraceptive medicines into the female. Means it is either 50% in some females, there may be after the administration of oral contraceptive there may be 50% chances to return the fertility, or in some time it occurs that there is no chances of fertility into the female. So this is major side effect of the contraceptive. So they are effective. These pills or the female contraceptive are effective, convenient, and they are safe, and they are available into the low cost. They are injectable or orally. They orally घेतले जातात and also injectable. Here we discuss only about orally. But in general information about injectable, or that is parental route, they are given by intramuscular route. Some advantages of this parental route taken contraceptive are they return fertility within the 6 to 30 months. Then sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So the types of female contraceptive, in which first one oral contraceptive and second one injectable, that is parenteral contraceptive. In oral contraceptive, this combination pill, sequential pills, mini pills, emergency pills, and also phasic pills are taken. And about injectable or the parental pills, they are given by the intramuscular route. Some their disadvantages or the adverse effect are as follows, in which weight gain is to be observed, decrease the bone density, then the return of the fertility. It takes the 6 to 30 months. This is a major adverse effect if contraceptive taken by the parental route. Also, excessive bleeding is to be occur. Sometimes amenorrhea is to be occur. Then menstrual irregularity is to be occur, and there may be increase the risk of or chances of the breast cancer if female taken the contraceptive by the parental route. So this is about parental or injectable contraceptive. Then let us discuss about oral contraceptive. Combination pills. So combination pills means there is combination of hormonal preparation, that is estrogen and progesterone are combined together, and their proportion is to be either estrogen it is taken by 30 microgram and progesterone is to be 60 microgram, and they both are combined together, and their pills name is to be given as ethylene estradiol pills. So combination pills, estrogen, ethylenoestradiol, they both are combined together. And what is trade name of this preparation? It is visible in your screen. Trade name.
Humulans.
Hemophilin. So combination pills means two hormonal preparations are combined together, such as 30 microgram and 60 microgram of estrogen and progesterone respectively, and their preparation is to be get ethylene, ethinyloestradiol, and their trade name it is hemophilin. Remaining preparations are given into the handwritten notes and also in your book of in your book of Pharmacology and Toxicology, Nirali Prakashan, Rajendra Kain book. So see these preparations. Then next is sequential pills. Ethinyl estradiol, progesterone, in which when this preparation made from the progesterone synthetically, then their name is as dimethicerione and their trade name is Oracon. Then next mistranol, their trade name is Norquin, and last one is mini pills. So these mini pills they are daily given or they are taken daily without any gap. Mini pills means they are in small dose and their preparation, progesterone preparation is Norestril and their trade name is Orviti. Only progesterone is in the mini pills. This one also asked for MCQ. Mini pills are formed by using which hormone? Which hormone?
Progesterone.
Because only progesterone is to be in the mini pills and it does not assure about fertility. And these mini pills, they are the smaller preparation and there is need to take these tablets or these pills daily route without any gap. About sequential, they may be prepared from either estrogen or progesterone. If they are prepared from estrogen, they are known as ethinyl estradiol. And when they are prepared from progesterone, they are named as dimethicerione and their trade name will be Oracon. Combination pill, as per their name, both hormones are combined together. Their trade name is hemophilin. Then phasic pills, that is triphasic pills, in which also combination of estrogen and progesterone. Phasic, why they are named as phasic? Because they are given 7 days after the 7 days, first dose within the first 7 days, second dose start from the 8 days to 14 days, and third dose is started from the 9 to 20 days. So phasic pill, this dose is for the 21 days. So these are the different oral contraceptive. The next point is how they act after administration of this oral contraceptive, how they act, what is their mechanism of action, and at the end it produces or it prevents the conception into the female. So this mode of action we will discuss in it. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
37 roll number, are you present?
Yes, ma'am.
Read the mechanism of action.
Mechanism of oral contraceptive, hormonal birth control, medication prevent pregnancy through the following ways. By blocking ovulation, release of an egg from the ovaries, thus preventing pregnancy. Second, by altering mucus in the cervix, which makes it hard for sperm to travel further. Third, by changing the endometrium lining of the uterus so that it cannot support a fertilization egg. Fourth, by altering the fallopian tubes, the tubes through which eggs move from the ovaries to the uterus, so that they cannot effectively move egg toward the uterus.
Mechanism of action of oral contraceptive or mode of action of this oral contraceptive after the administration of oral contraceptive into the female, how it produces the effect or how it acts. It is given as follow: hormonal birth control medication prevent the conception of the pregnancy through the following way, in which first one by blocking the ovulation. Ovulation means, as you all know, it is a process in which release of the egg from the ovaries and thus preventing the pregnancy. Means this oral contraceptive act on the ovulation phase, that is, they prevent the release of egg from the ovaries. And if there is no release of egg from the ovaries, then there is no fertilization is to be occur. And by this way, oral contraceptive prevent the conception. Then next point, by altering the mucus in the cervix and which make it hard for the sperm to travel further. So cervix, it is a narrow passage forming at the lower end of uterus. It is part of uterus it is a narrow passage lining of the uterus. So by altering means by changing this mucus in the cervix, whenever they change into the narrow passage of the uterus, there may be no transfer of or traveling of the sperm is to be occur, and again it leads to no fertilization is to be occur. And if there is no fertilization is to be occur, means there is no fusion in between the male and female gametes, then they do not form the zygote. So by this way, this altering or changing the mucus of the cervix, it acts as a contraceptive or it prevent the conception. The next point, by changing the endometrium. What is endometrium?
Lining of uterus. Layer right uterus.
So endometrium, it is a mucous membrane lining to the uterus. So this oral contraceptive, they act on this endometrium and they change this lining of uterus. And whenever there is change in the lining of uterus, they cannot be support for the fertilized egg. When they do not support or cannot support the fertilized egg, then again same, there is no fertilization is occur. That is, though there is no male and female gametes fusion is to be occur, and there is no formation of zygote is occur. That is, it leads to prevention of the conception. The next point, by altering the fallopian tubes, means fallopian tubes and ovaries, these are the major organs of the female reproductive system. So in this oral contraceptive, they act on the fallopian tubes. How many tubes are present? What is the role of this tube, fallopian tubes? They are in pair, right?
Yes, ma'am. They move the egg towards the uterus.
Okay. So they are in the pair. Then am I audible to all?
Yes, ma'am.
Yes, ma'am.
Last mode of action we can say mode of action and the pharmacological action of the oral contraceptive after their administration, how they act. So we are discussing about last point, by altering the fallopian tubes and the tubes through which eggs move from the ovaries to uterus. So they are available in the pair form in their anatomy or in their physiology. You already seen by these fallopian tubes are in the pair, and the tube through which eggs is to be moved from the ovaries to the uterus. So this normal function of this fallopian tube is altered, changed by this oral contraceptive. And whenever there is no movement or no move of these eggs from the ovaries to uterus, then it is avoid the or prevent the conception, so that there will be, they cannot move the eggs toward the uterus. If there is egg not move towards the uterus, then there will be same again, no formation or no fusion in between the sperms and the eggs, and there is no zygote formation is to be occur. That is, there is fertilization process not occur properly, and it leads to prevention or the conception of the pregnancy. So these function or pharmacological action or mode of action of the oral contraceptive, they act by different mode of action, but they having the same therapeutic effect or the same pharmacological action, that is prevention of pregnancy or prevention of conception. The next point, do you understand all these points from the mechanism of action?
Yes, ma'am.
The next point, side effect after taken this or administered this oral contraceptive, then it produces some side effects such as follows. Roll number 5, read the side effect.
Nausea, vomiting, headache, lethargy, or edema, mild depression, serious side effect, amenorrhea, weight gain, increased skin pigmentation, vaginal infection. Moderate side effect includes uh, thromboembolism, myocardial infection, GIT disorder.
Okay, so nausea, vomiting, and headache, these are the common side effects. You can write because this preparation given by which route?
Orally.
Orally. So
Oral.
nausea, vomiting, these are the common side effects. Lethargy, what is mean by lethargy? Any idea? Lethargy. Any idea about this? There is lack of energy. That is euthasium. So it is a pathophysiological condition in which lack of energy is to be occur. So this lethargy, it is also side effect of loss of energy after the administration of oral contraceptives to be occur. Then edema and mild depression. Depression. Maiti depression, edema. Yes or no?
Yes, ma'am.
Yes, ma'am.
Depression means what happened?
Mentally disturbed.
CNS is get depressed. Then serious side effect. Some serious side effect observed after administration of oral contraceptives such as amenorrhea. Amenorrhea means amenorrhea we discussed in the therapeutic application of synthetic estrogen. So amenorrhea means there is absence of the menstruation. The next point is weight gain. Then next, increased skin pigmentation. Skin color is to be get changed. Then vaginal infection is to be occur. Then next point, moderate side effect. It includes thromboembolism. What is meant by thromboembolism? We discussed the side effect in drugs acting on CVS. What is meant by thromboembolism? Sound is audible to all.
Yes, ma'am.
Clot formation in
Thromboembolism.
blood vessels.
Repeat again.
Clot formation blood vessels in blood vessels.
Okay, so there is formation of clot into the blood vessel, and they cause do not proper flow the blood into the whole circulatory system or into the whole body. So blocking of blood vessel by the particles, and they form because of formation of clot. So thromboembolism is a major adverse side effect of this oral contraceptive myocardial infection or infraction means it is related to which disorder? Myocardial means disorder related to which organ?
Heart.
Altering disorder.
Then next GIT disorder. So gastrointestinal disorder sometimes occurs. Myocardial infarction means it is related to heart. There is similar to heart attack. Blockage into the blood flow is to be occur. Blood flow जो heart muscle ला होतोय तो stop होतो, block होतो. And that's why this myocardial infarction is to be occur. And GIT disorder, that is gastrointestinal disorder. So these are the side effects of the oral contraceptive. The next point, contraindication. So oral contraceptive are contraindicated into the following condition, in which migraine. What is mean by migraine?
Severe headache.
Severe headache.
Half headache, that is migraine. Thromboembolic disorder, same like thromboembolism. Then next, vaginal bleeding, hypertension, increase in BP, epilepsy. What is mean by epilepsy?
Convulsions.
Epilepsy means, go outside. What is mean by epilepsy? What happened in this condition? It is serious disorder, right? Am I audible to all?
CNS disorder.
Okay. So epilepsy, it is an CNS disorder where nerve cell activity into the brain, it gets disturbed and which causes seizures. That is involuntary or the sudden movements is to be occur. That is epilepsy. Then next, liver diseases, hepatic diseases, and breast and uterine carcinoma. That is, if there is cancer of breast and uterine, then these oral contraceptives are contraindicated in such a condition. Then next point, drug interaction. What is meant by drug interaction? Definition of drug interaction. Can anyone tell me the definition of drug interaction? Drug interaction chapter we cover in
Of the one drug produced
first
by
unit.
another drug.
Repeat again.
The one drug produced by the another drug effect.
One drug produced by the, there is alteration in the pharmacological action of one drug by another drug. So how many types of drug interaction we discussed in the first unit?
Two type.
Which?
Two type.
Drug interaction outside the body and drug
body.
interaction inside the body.
And after that, in drug interaction inside the body, we discuss about during drug interaction occur during the pharmacokinetic and drug interaction occurring
Pharmacodynamic.
during the pharmacodynamic. Okay, so drug interaction is to be may be possible whenever administration of the oral contraceptive, in which first one antibiotics like ampicillin, tetracycline have been known for failure of the oral contraceptive. Means if any individual taken antibiotic tablet, or this female who administered the oral contraceptive and also administered antibiotic tablet, when they get this both antibiotic and oral contraceptive interact together, and there may be failure to the effect of oral contraceptive. Means antibiotic त्याचा इफेक्ट दाखवतात आणि oral contraceptiveचं जे action आहे to prevent the conception, it get fails because of presence of antibiotic. Then next is drugs like phenytoin. What is category of phenytoin?
Antiepileptic.
It is anti-epileptic or anti-convulsant agent. Phenytoin derivative, for example, phenytoin. So drugs like phenytoin and phenobarbital. Category of phenobarbital?
Sedative.
Sedative
Sedative.
hypnotic, in which long-acting barbiturate, right? It is in long-acting barbiturate. Is it right or wrong? Remember classification
Yes, ma'am.
of sedative and
ma'am.
hypnotic. Okay.
Yes,
So
ma'am.
this phenytoin, that is anti-epileptic agent, and phenobarbital, that is sedative hypnotic agent, they are potent inducer of hepatic microsomal enzyme, is accepted to increase the rate of metabolism of contraceptive. Means ज्यावेळेस oral contraceptives administration केले जातात, also at that time that female take an anti-epileptic or hypnosedative agent. At that time हे जे दोन्ही ड्रग्स आहेत अँटी-इपिलेप्टिक अँड हिप्नोसेडेटिव्ह ड्रग्स, हे काय करतात? दे आर इंड्युसर ऑफ हिपॅटिक मायक्रोझोमल एन्झाइम. त्या एन्झाइमला इंड्यूस करतात, प्रोड्यूस करतात, and that's why he is expected to be increase the rate of metabolism of contraception. म्हणजे त्या कॉन्ट्रासेप्टिव्हचा रेट, मेटाबॉलिझमचा जो रेट आहे तो काय होतो? इन्क्रीज होतो whenever they are taken with the, or there may be drug interaction of anti-epileptic agent and hypnosedative agent. So this is about side effect. Do you understand side effect?
Yes, ma'am.
Yes, ma'am.
Side effect समजले की ड्रग इंटरॅक्शन समजले, काय बघतो आपण?
Drug interaction.
Then how could you say yes? ड्रग इंटरॅक्शन बघतोय आपण, त्याच्यामध्ये दोन आहेत अँटीबायोटिक लाईक अँपिसिलिन, टेट्रासायक्लिन, त्याच्याबरोबर ओरल कॉन्ट्रासेप्टिव्ह घेतले. ऍट दॅट टाइम देर इज फेल्युअर ऑफ ओरल कॉन्ट्रासेप्शन. अँड सेकंड वन अँटी-इपिलेप्टिक एजंट असतील किंवा हिप्नोसिडेटिव्ह एजंट, when they are taken with the oral contraceptive, then they act, this both agent phenytoin and phenobarbital act as inducer of hepatic microsomal enzyme, and they increases the rate of metabolism of contraceptive. म्हणजे फर्स्ट दाखवतोय तो इफेक्ट आहे की फेल्युअर ऑफ ओरल कॉन्ट्रासेप्टिव्ह, आणि सेकंड जो आहे इन विच ड्रग इंटरॅक्शन इज टू बी प्रोड्युसेस increase the rate of metabolism of contraceptive. Do you understand drug interaction?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
The next one is about note about this oral contraceptive, that is some precautions should be taken.
मॅम ते कॉन्ट्रा इंडिकेशन एकदा सांगा की.
Yes,
कॉन्ट्रा इंडिकेशन त्याचा वरचा पॉइंट ड्रग इंटरॅक्शनचा.
contraindication repeat करायचे का?
येस मॅम.
Okay, after the drug interaction repeat this contraindication. So in the drug interaction, mainly two drug interaction is to be occur possible after the administration of oral contraceptive. Then some precautions should be taken while administration of this oral contraceptive. Oral contraceptive must be discontinued if persons report that headache and acute visual disturbance. Means the female who taken this oral contraceptive or any individual who taken this oral contraceptive to prevent the conception, if the side effect or the symptoms are observed such as headache or actual visual disturbances, means there is inability to see, the symptoms are observed, then discontinue this therapy. तर ती oral contraceptive जे pills आहेत त्या stop करायचे. Then next precaution is great care must be taken in case with previous history of asthma, diabetes and endocrine disorder. The individual who taken this contraceptive, if there is previous history of this individual or this patient having the asthma, diabetes or endocrine disorder, then such person have to take major care after or during the administration of this oral contraceptive. What is asthma?
Difficulty in breathing.
What is meant by diabetes?
Increase in blood sugar.
Increase the blood sugar.
Endocrine disorder. Do you know any endocrine disorder? माहिती आहे का endocrine disorder? What is the difference in between exocrine and endocrine?
Exo means same and endo means different.
This is in general. I'm asking about hormone, enzymes. Means exo and endo जे आता सांगितलं त्याचं झालं की homo and heterotype same and different. I'm asking about endocrine and exocrine. What is difference in gland मधला difference विचारते मी exocrine glands. We are discussing about precautions. So this oral contraceptive when they are taken in endocrine, जर endocrine disorder असतील and at that time if any individual taken this contraceptive तर त्यावेळेस जास्त केअर घ्यायची. So what is endocrine disorder? Endocrine disorder म्हणजे कशाचे disorders? It is related to
Endocrine gland directly blood मध्ये secrete होते. आणि exocrine.
endocrine disorder means hormonal disorders. As we discussed, if there is deficiency of insulin, then what happens? You have to recall this hormone and hormone antagonist unit from the first chapter. If there is deficiency of insulin in the pancreas, then which endocrine disorder is to be occur?
Diabetes mellitus.
Diabetes mellitus.
And if there is deficiency of thyroid hormone, then decrease in level of thyroid hormone. This disorder is termed as hypothyroidism. And if there is increase in level of thyroid hormone in thyroid gland, then this disorder is known as
hyperthyroidism.
Hyperthyroidism. And if endocrine disorder means the same, ज्या हार्मोनचे रिलेटेड डिसऑर्डर आहेत त्या डिसऑर्डर असतील त्या इंडिव्हिज्युअलला, दॅट इंडिव्हिज्युअल हू टेकन दिस ओरल कॉन्ट्रासेप्टिव्ह आणि त्या पेशंट मध्ये त्या इंडिव्हिज्युअल मध्ये एंडोक्राइन डिसऑर्डर असतील तर देर मे बी प्रॉपर केअर शुड बी टेकन. Then It is better to follow the advice and examination by gynecologist before the person subjected to the oral contraceptive therapy. Before administration or taken this oral contraceptive by own perception or by own decision, it is better to follow the advice or examination under the gynecologist. Gynecologist means gynecologist. Kai, physician, doctor, which is specialized into the female reproductive health. So this physician is known as gynecologist. So before administration of this oral contraceptive, some precautions should be taken, such as first one is to be, it is better to follow the advice of this gynecologist, and under the examination of this gynecologist taken this oral contraceptive therapy. Second one, if the individual it suffer for the asthma, diabetes or endocrine disorder, previous history of disorder, then proper care or great care should be taken, more care should be taken. And last one, one precaution is to be, if there is reports such as headache, actual visual disturbances is to be occur, then discontinue this therapy, म्हणजे ती therapy, oral contraceptive therapy stop करायची. So this is about their precaution. Okay, contraindications repeat करायचे. Contraindication means oral contraceptive. They are contraindicated, means they are not taken if there is following conditions, such as first one is migraine. Migraine means half headache. Thromboembolic disorder. Thromboembolic disorder means it is similar to thromboembolism. That is, there is clot formation is to be occur into the blood vessel, and that's why there is no proper blood flow is to be occur into the circulation. The next point, vaginal bleeding, means there is bleeding from the vagina. Then next point is to be hypertension. As you all know, there is increase in the BP. If this condition, then such type of the individual or patient or the females cannot take the oral contraceptive. The next one is to be epilepsy. Epilepsy means there is related to CNS disorder, and involuntary actions is to be occur. The next point, liver. Involuntary movement is to be observed into the epilepsy. Then liver diseases and breast and uterine carcinomas. There is cancer of uterine and breast. Then in such a condition or in such a patient, oral contraceptive are contraindicated, means they are not given. So here we complete from the hormone and hormone antagonist. Female sex hormone, male sex hormone and their antagonist, that is oral contraceptive. So in today's lecture, we discuss about, we started this lecture from the male sex hormone, in which female sex hormone, firstly estrogen, progesterone, if they are synthetically, sorry, if they are not orally active, then they are given by the parental route and they are prepared by their synthetic formation. And you have to remember one more thing, there may be, if testosterone or androgen, they are secretion of male reproductive system. जरी ते मेल रिप्रोडक्टिव्ह सिस्टीमचे सिक्रिशन असले तरीही ते स्लाइट अमाउंट मध्ये, स्मॉल अमाउंट मध्ये फिमेल रिप्रोडक्टिव्ह सिस्टीम और इन द ऍड्रिनल कॉर्टेक्स, जे ऍड्रिनल ग्लँड मध्ये ऍड्रिनल कॉर्टेक्स आहे. डू यू नो ऍड्रिनल कॉर्टेक्स? माहितीये का ऍड्रिनल ग्लँड, ऍड्रिनल कॉर्टेक्स?
Yes, ma'am.
Am I audible to all? Am I audible to all?
Yes, ma'am.
Yes, ma'am.
The location of adrenal gland. Speak loudly. Location of adrenal gland.
Upside of kidney.
Upside of kidney.
Okay, so adrenal gland. Okay, so adrenal gland, it is an endocrine gland. and it produces a variety of the hormone, and major hormone कोणता आहे adrenal gland चा? Secretion कोणतं आहे? Adrenaline. Is it right or wrong? Second year समजते का काय चाललंय ते? Adrenaline gland. It is present above the kidney, right? Okay. So the adrenal cortex, adrenal medulla. Whenever we discuss about diuretic at that time, this point we discuss adrenal cortex, and also I think adrenal CVS च्या starting मध्येही झाले. There is two pathway. दोन pathway होते. In which concept?
Antihypertension.
Mechanism of action.
Yeah. So in the antihypertensive adrenal cortex मध्ये एक होता आणि another one into the inner and outer असं काहीतरी होतं, right?
Yes, ma'am.
Adrenal cortex another कोणतं होतं?
Adrenal medulla.
Adrenal medulla.
Adrenal medulla. So जे adrenal cortex आहे त्या adrenal cortex मध्ये if testosterone or androgen, it is a male reproductive hormone, but in the slight amount it is secreted into the very slight amount it is secreted into the female reproductive system or into the adrenal cortex. If there is increase the secretion of this testosterone, the slight amount when the secretion are increase at that time in this female, some symptoms or this well, there may be change into the voice or there may be increase the growth of hair is to be occurs. Female shows the male like symptoms or male like character. जर ते secretion increase झालं तर musculization, this is termed as a musculization. This happen. Then next point we discuss about female sex hormone is contraindication. Then side effect. After that we discuss progesterone, their side effect, therapeutic applications, contraindication, preparation. Then male sex hormone, androgen or the testosterone, it is termed as gonads or the testosterone or the gonads or androgen. Then this point is to be important one. LI stimulate interstitial cells, and FSH, they promote the spermatogenesis process. The also secretion is to be important one, 350 to 1200 mg per year, and it is in the ml, that is secrete and a testosterone hormone in 5 to 12 mg daily. The next point we discuss about it. They are produced into the also similar that ovaries मध्ये testosterone slight amount मध्ये secrete होतं. Then this musculization effect, if there is excessive secretion, then musculization effect is to be observed. In their pharmacological action, we discuss about it is responsible for growth. It is growth of reproductive system, growth of hairs, that is auxiliary hairs, pubic hairs. Then it is responsible for secretion of sebaceous gland, that is oily secretion. Behavioral changes means aggressiveness, excitement, and increase the physical activity. Then maturation of the sperm, skeletal action, it is important for the growth of skeletal muscle and increases the growth of bone mass and erythropoiesis process. After that, we discuss therapeutic application, means in which condition that the synthetic testosterone are applicable, in which cryptochildism, there is absence of testes or gonads into the child, then replacement therapy into the hypogonadism, then breast cancer, aplastic anemia, leukemia. Pharmacokinetic. After that, adverse effect, contraindication, preparations, we discuss. And oral contraceptive, in this chapter we discuss their definition, then how they act. Okay, this is again same point related to their mechanism of action. The progesterone synthesis inhibit करतात, then त्याच्यामुळे ovulation prevent होतं, and whenever ovulation is get prevented, then there will be less pass of this sperm, and whenever there is no transfer of the sperm, that is no fusion in between the sperm and the ovulated eggs, that is, it leads to prevention of the conception. So by this different mode of action, it acts by the same, or it produces the same pharmacological effect, that is prevention of the pregnancy. Then next, there are different formulations are used in which oral contraceptive or injectable contraceptive, female contraceptive or the male contraceptive, in which female contraceptive injectable parentals, they show many side effects or the disadvantages such as excessive bleeding, menstrual irritability, increase the risk of breast cancer, weight gain, decrease the bone density, permanent infertility also occur. So that's why this injectable or parental contraceptive taken into the female, they may be in rare cases, and if they are administered by the oral, then available preparations are combination pills, sequential pills, and mini pills. Mini pills, they are taken daily. They are available in the small dose. Combination pills means there is combination in between the hormones. Either it is testosterone, progesterone, estrogen, any of the hormone. Then next point we discuss about their trade names and their preparation, side effect, nausea, vomiting, some severe side effect or serious side effect, amenorrhea, weight gain, skin pigmentation, that is color change. Also, GI disorder, thromboembolism are the moderate side effects. Then we discuss about contraindication and drug interaction, and also there may be 3 points into the precaution. It should be taken by advice of gynecologist or under the examination of gynecologist. Then more precautions should be taken if there is that individual having the previous history about asthma, diabetes, or the endocrine disorder. And last one precaution is to be if there is reports such as headache or acute visual disturbance is to occur, then they may be stopped. And last point about drug interaction is whenever they are taken with the phenytoin and phenobarbital, then they increases the metabolism of contraceptive. And second one is to be antibiotic like the ampicillin and tetracycline. At that time, there may be failure of oral contraceptives to be occur. That is, there may be no conception or no prevention of pregnancy is to be occur. So this is about hormone and hormone antagonist. All of you understand up to this? Any doubt?
No, ma'am.
All of you, any doubt related to this point
No, ma'am.
or up to this point?
No, ma'am.